Hello, and thank you for joining us for this different live Q&A in aid of Cervical Cancer Screening Awareness Week. Today for the Q&A, we have got two very inspirational ladies with us. So I would let them introduce themselves. Dr. Kavita, if you want to go first.
Hi, Lizzie. Hi, everyone. My name is Kavita. I'm one of the senior registrars in gynae oncology at the Royal Surrey County Hospital, so just across the road from the university campus. So my primary role is looking after women who've either been diagnosed with a precancerous or a gynecological cancer and looking after them during their cancer journey. Lucy, over to you.
My name's Lucy Dodds. I am a wife, a mum, a teacher, and back in June 2018, I was diagnosed with stage 1, grade 2 cervical cancer. And thank goodness I can say I'm a survivor of that. And I'm here, and my main aim is to help raise awareness of cervical cancer and other gynae cancers. Thank you.
Fab. Thank you both for joining us. We've got some questions kind of ready in here, but anyone that's watching at home, if you do want to ask any questions throughout kind of the Q&A, just put them in the comments and we'll do everything we can to ask them for you. So I think I'll start with quite a broad one. Probably Dr. Kavita, one for you. In simple terms, what is a smear test? What is one?
Okay, so that's a very good question. So, and I've got a few pieces of kit, so I thought I could just talk through what exactly it is. So one thing that people have to understand, and I say this very often, is that screening programs, and we've got 3 in this country, are designed to pick up healthy people like you and I, and basically take us through a process. It's a bit like, when you take your car for an MOT, you're not expecting a problem. You have a check and you ensure that there's no problem. And that's really what a screening test is. So cervical smears are essentially a test to check what the cervix is really doing. So when people talk about cervical smears and cervical tests, I think the first thing to do is just take a step back and think, what exactly is the cervix? Okay, so there's really nothing to be shy or embarrassed about it. The cervix, or the neck of the womb, or the uterus as it's called, is really a small canal or tunnel that allows access into the womb or the uterus. So many people refer to it in different ways. So patients who come in to see me, they look at my art, and I had one patient actually say to me, that looks like an upside down bottle. And that's really exactly how it is. If you think of an upside down bottle with a long neck, so really that canal is the cervix. Now, when we do a smear test, what we do essentially is, it's not a swab test. So, lots of us have swabs done to just check for infection. So a smear test is essentially done. We use a brush like this, and the idea is to try and look at the cervix. Once we've visualized it, just take some cells off from the cervix, put it off in a pot like this, and then put the patient's details, and then we send it off to the lab to be analyzed. So smear test has recently changed. So if you think about it, we've had the screening program since 1988, perhaps long before some of you were born. And essentially, the idea was to pick up abnormal cells. But there's obviously been research ongoing, and we've learned a lot from this research. And this research basically says that 70% of cervical cancer is caused by the very, very naughty and notorious HPV virus, or the human papillomavirus. Now, it doesn't just cause cervical cancer. In women, it can also cause cervical, vulval, or vaginal cancer. But in men, it can cause penile or anal cancer or throat cancer. So, we all harbor this virus. The idea is to, with this brush, pick up those cells, check for the virus, and look for the high-risk virus, treat it, and then we're preventing the cancer from happening. So essentially, we're trying to stop it from actually going to a cancer, so then we don't have a diagnosis of cancer. So that's really so lots of people think that it's a check for cervical cancer. It's not. It's a check for precancerous cells so that we can treat it and stop it there. So that's really what it is.
Fab, thank you. And then coming to you, Lucy, if you don't mind, what was your kind of experiences kind of around smear tests and kind of when you had your first couple and things like that?
No, it's a great question. I was a regular person who went for their smear test. As soon as the letter came in the door, I would be making my appointment to my GP, and I went, had my test done, and I got a letter back saying that I had to go for further tests. Now, I just went, had my test, my let's test, and they actually at that time took a biopsy. Now, you've got to remember, I'm one that had nothing. No early infections. I just went from a smear, not thinking anything much about it, because it was something I had done regularly. And actually, when they took the biopsy, unfortunately, they did find that I did have cancerous cells that had developed from HPV virus that I'd had maybe 20 years before. So it had taken that amount of time. So this was literally, I sadly found out the day before my 46th birthday. So it had actually taken maybe up to 20 years for those cells to get to the stage which they were at. But I had had no symptoms beforehand, and that's something that I think is really important, that for people to know that you will not always have symptoms that you may read about.
But I think it's also important at that stage to understand and emphasize, we all have the HPV virus, okay? We all harbor the HPV virus. And because, you know, there's a lot of myth and misconceptions around it, thinking, you know, does that make me bad? Does that make me, I've had, you know, women ask me, that's a dirty thing? And it's not really, because we all harbor the HPV virus. So it's what we're trying to look for is really the high risk types that tend to become cancer. So, you know, I don't think we should really be caught up or worry about the fact that we have the HPV virus. Most of the population will have it, okay? And hence the vaccine has come in to try and vaccinate boys and girls, I'm pleased to say, in school, so that it definitely reduces not just the risk of precancerous cell, but also the very annoying genital warts. Okay, nobody likes warts. We particularly do not like genital warts, and they're annoying, they're a nuisance. So, you know, so the vaccine is a fantastic thing as far as that is concerned.
I mean, I was just going to add in there about the HPV vaccination, and, you know, we're tested, there's over, as I understand, over 200 types of HPV, and the HPV vaccination is testing against 4 of them, of which I then understand there are 13 main types of HPV that can lead to cervical cancer. So I have a daughter who, you know, and she's been at the stage where she's now had her second HPV, but I believe and understand just by speaking to many people that many young people who have been through that process of the HPV vaccination, they're kind of misinformed. They then believe that actually we don't need to have smear tests in the future. And that is where it's a big grey area. And that's something that through this and through many other areas that we want to go down the route of, that we need to get that message across, that just because you've had that HPV, you will need to go for a smear test when you're invited, and you may be invited from the age of 25. So important that I think people know that.
So, you know, undergraduates and postgraduates, you know, undergraduates potentially should have, at this stage, they should have potentially had the vaccine. So, you know, girls and boys coming through should have probably, so boys are only now in year 8 being offered the vaccine from last year, but anybody under the age of 25 can still request it on the NHS. Now, girls should have been having the vaccine for a while. And as Lucy says, I mean, at the moment, the vaccine that's available on the NHS is against 4 virus subtypes, 2 of which are low risk, as I said, against the genital warts, but then 2 of them are against the high risk types. Now, there is a little bit of, so for some of the science geeks who might be watching this, you know, there is a little bit of genetic makeup cross reactivity. So, you know, even though we say that the high risk types are 16 and 18 HPV types, there is also a little bit of crossover with 31 and 33 and sometimes with 45. So there's a little bit of crossover. So it's really a good thing. And there's a lot of research that's being done, and I think we're very close to introducing the next level of the vaccine, which is supposed to protect against 9 subtypes. And I'm really excited about this, and, you know, which I think is going to be fantastic, and it's really, really going to help. So, so I think, yeah, this is something for us to look out for, and I'm very excited about it.
Definitely, thank you both for that. So I think looking into it a little bit more, I think a lot of young women out there kind of would want to know what happens at a smear test. So how long do they take? What do they do? Is it somewhere special? Is it at their GP? So Lucy, I don't know if you want to talk about it kind of from your view, and then Dr. Kavita from kind of your angle.
Well, I'll go first. I mean, for me, you know, when I was 25 and I went for my first smear test, I have to say it was the most intimidating thing I had ever done. I was scared. I was nervous. I was embarrassed. But I have to say 5 minutes of that initial embarrassment then led on, you know, it educated me. It made me realize that 5 minutes was worth it in the future, knowing that I would only have one of these every 2 to 3 years. You go in and, you know, it's really important to know that you don't need to be alone on this. You can go in, you can take a friend, the GP surgery can at points organize someone if you want to be behind the curtain, and, you know, just someone there to hold your hand. It isn't, you know, it's 5 minutes of a little bit of discomfort. You know, you have to lie down, you know, take your underwear off and open your legs, just so, you know, so the doctor can do, or the nurse has to do what they have to do, and to make sure that they get that test done properly. Now, my thing, even as I got older, yes, it's still quite embarrassing, but as I say to my children and to anyone else I meet, you know, we'd go to the doctor if we had a cut on our arm that was infected. We would go if we hurt our bone in our body to have them looked at. You would go if you had a poisonous toe. So at the end of the day, this is just another part of your body. And the sooner that we educate, and the earlier that we educate, you know, from young children. And as a teacher, this is what we're doing through relationship and sex education. We're teaching children the proper names of parts of their body. So as they then grow older, that they're not embarrassed to talk about their vagina. They're not embarrassed to talk about their penis. It's just like talking about their nose, their mouth, their arm. And that's the way our bodies should be. Not to be embarrassed, to know that this 5 minutes of slight discomfort actually can save our lives. And as I say, 20 years on, I'm still going, well, I was still going for my smears, because I have had, because of my cancer, I had to have a radical hysterectomy. So I don't have a womb anymore. I don't have a cervix. I don't have a uterus. But I was very lucky that mine was caught early enough. And again, that was with me going for these regular smears. So my aim is to get women who are a bit scared, a bit uncomfortable, go there, make that call. It's really important. And as I say, 5 minutes of discomfort can save your life. So thanks, Lizzie. That was my experience. A little bit of discomfort along the way, but certainly important.
Thank you, Lucy. Yeah, definitely. Dr. Kavita, if you could give us a bit of kind of background around your end of things.
So, okay, so I'll talk about it from a professional perspective. Okay, so essentially, the way the program is designed, so, you know, as a special treat, when somebody is 24 and a half, they get a letter in the post which says you're invited to come along for a smear test. And it's probably, you know, quite a frightening thing, and it's probably quite a worrying thing, but I recommend that people talk to whoever they feel most comfortable talking to. And as Lucy said, take somebody with you. I mean, bring somebody along to clinic with you, because we often, it's nice to see, when I see a patient, young or older, you know, it's nice to see that they've come along with somebody, because, you know, even when I'm a patient and if I have to go to clinic, you're not going to remember everything that you're told. So it can be quite daunting going to a consultation with a nurse or a doctor for a smear test. And often when you get there, what you have to probably remember is that you don't it's not a given that you have to have the test done. You can have a chat, you can ask questions, and then if you don't feel ready, don't feel like you're comfortable doing it on the day, because you've got to remember you should not be on a period to have it done. You should feel really comfortable, and it's only when you feel, yes, I'm ready to do this, that it's worthwhile going ahead to do it. Okay. The other thing to probably remember, yes, so it's an examination of the cervix. So, you know, women will often be on a couch. And so what I tend to say is to patients is, you know, try and perhaps, if you feel comfortable, wear some loose clothes that, you know, a dress, if you want to easily lift it up, or a skirt that's easily lifted up. So, you know, so things like tights or trousers, it's fine, not from my perspective, but it's more about what you feel most comfortable getting on and, you know, taking it off kind of thing, which is really the most important thing from a patient's perspective. And then obviously it is going to be uncomfortable. I'm not somebody who's going to say no. There will be discomfort in some women, perhaps more than others. Okay, and it's also the fear and the anticipation, not knowing what's going to happen. So that is also quite worrying to people. And then, so what I tend to say to people is, lie down on the couch, relax, and when they're ready, I like to walk them through the process if they're interested. So what we tend to use in the clinic is, and I've got one of those here, is really a speculum. Okay, so we use a speculum, and basically what we do is open up the speculum so that we insert it through the vagina, open up the speculum so we can see the cervix. Once we visualize the cervix, as I said before, we do the smear test. Now, sometimes people can be worried, oh, am I going to bleed or spot after that? Yes, there might be a bit of spotting, but then that usually settles down. So it's not something to actually rush into, but also on the other hand, if you're concerned, I would say rather than ignore it, perhaps pick up the phone or actually go to the appointment. I mean, as I said, it's not a commitment. So, most clinics that you go to, you'll probably find that the nurses or the doctors, they're there to support you, get you through the process and help you through the process. Most of them are experienced, and if there's any concerns or questions, that's what they're really there for. We're here to basically help people through the process. So if you're not ready today, that's absolutely fine. We can always say, well, we can come make an appointment for another day, come back. And I've had patients do that and say, actually, I don't feel comfortable, or I've just realized I've come in, but I've left, I've got something I need to do and I just don't feel ready, and that's fine. And we can talk about it. Hopefully, allies and fears, people can go away and come back on another day and have it done. And again, it's not something that has to happen very often. So up to the age of 50, it's only once every 3 years, unless there's some I don't like using the word abnormal, because it's not, it's such a strange word to use. It's not abnormal. It's just that, we found something that needs to be actioned. So essentially that's what it is. So if we find something that people need treatment, women need to come back a bit sooner, but otherwise it happens once every 3 years. So, and reminders are sent, so we get text messages reminding us. So really all I would probably say is take give it due attention, take some time to focus on this, react and respond to it.
And we're all women. We're all there for each other. And I think we've got, I love Kavita's, analogy of taking, you take your car to have its MOT done. That's what we're doing for ourselves. And actually it makes me smile when Kavita uses that. And, the doctors and nurses who are doing it, they are just like, like the guy in the garage. They're there checking you out, make sure they're okay. They do it every day. They don't think twice about it. It's fine. And I know I sit here and say that, but I can assure you that once you're in that door and that nurse or doctor can make you feel comfortable, and, I'll go, Kavita, when I've been with Kavita, she's always made me feel completely at ease when I've had to go for my, post operation checks. And, I still get a little bit nervous, and she knows that. And that's after having these tests over many years now. But it's all about looking after yourself. You go to the hairdresser, get your hair cut, look after your body.
If someone was to potentially kind of miss their call up to have a smear, for example, so they get the letter, they decide, actually, it's not for me, a couple of months later, they do decide. Is it a concern that may pop up is, do they have to wait a long time to be seen, or is it quite a quick, if you've missed your call up, can you be seen quite quickly?
Yes, I think if all you have to do is probably ring your surgery to make an appointment, and basically they will basically fit you in at the next available slot that's mutually convenient. And really, if there's any concern at that stage, if that's the time you think you're going to be on a period or you're concerned about it in any way, that's, it's a quick time to say, can I quickly chat to a nurse? And a nurse or a doctor might ring you back to discuss those concerns even before you make the commitment or even before you go for your test. So it's not a case of, do I have to go there and discuss all these things? And if this worry is to actually make that commitment to go there, all of this can be done beforehand, and that's really what I think. So,
and following on from that, if someone does kind of go for a smear test, and then they actually come back and they've had abnormal results, what would kind of be the steps after that? What does it mean to get abnormal results?
So that's a really good question, Lizzie. So, and I think a lot of people worry about that because they automatically think an abnormal result relates to cancer. And in most of the patients, it doesn't. Okay, so most of the women, it really doesn't. Because, so you've got to think about cells in the cervix as a spectrum, or you could think about it like a ladder, or you could, so, you know, essentially what you need to think about it is that normal cells are one side of the spectrum and the cancerous cells are completely on the opposite side. And these abnormal cells perhaps lie somewhere along that spectrum, okay? And in most women, they need either surveillance, which means you basically monitor them, or in some women, you have to treat them and then they regress back to normal. Okay, so it's in very few women that they actually progress all the way to cancer, and perhaps it's more common if it's untreated. So when an abnormal result essentially sometimes can mean actually that the test didn't pick up enough cells. So it can sometimes come back using the word inadequate. And again, that's a very odd word because it kind of means, it doesn't mean that it basically all that it means is the cells that were taken at the time of the smear test were not adequate. So they were not able to visualize enough of the cells so that they could actually say, yes, all is clear, you can go away and come back in 3 years' time. And that's really what it is. So that's what an inadequate one. An abnormal cells will probably mean, I mean, now most of the tests are to pick up HPV. So it will basically come back and say, you need to be seen. And the next letter that might come through is to be seen in a colposcopy clinic. Most colposcopy clinics are in the hospital. Some of them could be within a doctor's surgery as well, or in other smaller places. And essentially, a colposcopy is a checkup. So it does not mean a treatment for cancer. And often it's basically a colposcope is essentially like a microscope that we basically use to basically have a magnified view of the cervix. And essentially what we want to do is look at that cervix and map it out and make sure we can specifically see an area that we call the transformation zone. I mean, this is probably a bit too much, but essentially the human papilloma virus or the HPV virus loves to live in that area because the cells in that area are reproducing very fast. Okay, so if we're on the pill or for various reasons, so they may not have seen adequate cells, or we could not visualize that properly. And often all we want to do is check that, make sure it's fine, and that's really it. And you know, very often patients come in, have that checkup, we check and make sure everything's okay. Sometimes we may want to take a biopsy, but that's about it. So, you know, especially in young women, we are very, very, very mindful of what we have to do because all of this can have a long-term impact. But what people need to remember is that, essentially what people need to remember is that this can then have a long-term impact on themselves. So we're very, very mindful of that. So yes, it might spot or bleed a little, but not something that I would probably worry about. So as I said before, yeah, with a smear test, you can bleed a bit. And then with a colposcopy, if there's just a visualization, usually no bleeding. If a small biopsy is taken, yes, there might be a bit of spotting. Often we'll advise people to use a pad or a tampon, and then it should go away in a day or two. It should usually settle down by itself without any other problems. But the good news is that we're now having, so there was a pilot done of HPV self-testing, because as you can imagine, we don't like to go for smears. Despite all of these discussions, you know, many women will put it off, and you know, it's for various reasons. You know, so I put it off because I can't find a surgery that does evening smear tests. So often you will put it off for various different reasons. But there was a pilot that was done in London, and then and some places they've already rolled it out. So an HPV self-test is almost like using a tampon, which then has a brush, and then basically you collect the cells and send it off. So so there's lots of advances being made, and yes, I'm really looking forward to the time when it's all done as a self-testing, and which would be wonderful, because then really women for whatever reasons have that barrier to going for a test, then hopefully that barrier is eliminated, and we can all do this test in the privacy of our homes at our convenience and send it off.
Oh, sorry, go Lucy.
I was just going to add to that, and it's just actually will help those people who feel embarrassed, and also just be a further reminder to those who've had their vaccination that actually smear tests will be important, and they still have to go for them, and whether they're able to do it by going to the GP surgery or in the future doing their own test, the access to it would be much easier and much better.
Thank you, Lucy. A question that we just had come through as well, probably for you, Dr. Rita. Has smear testing been halted due to the coronavirus? And if so, how, if they do receive their letter during coronavirus, how can they reschedule it?
Yeah, so really good question, because yes, indeed, I mean, it was halted due to the coronavirus because we were concerned about the scale and the impact of it. However, having said that, I mean, I think everybody will be pleased to know that it's actually restarted now. So HPV testing has, smear tests have recommenced, and all you need to do is pick up the phone, ring your surgery, and it can all be rescheduled. As you can imagine, there'll be a huge backlog. So the screening program itself is writing out to contact people, prioritizing people who've had to come in due to either previous abnormal results or young women who've even not actually had a smear test. So it's really their first smear test. You build up to all this anticipation. It's been put off. So they are going through a prioritization process. However, what we tell people is that, well, if you've decided you're in that mindset, in that zone thinking, well, I just want to have it done now, well, pick up the phone, ring the GP surgery. The doctors and nurses are available, and they will give you the next available slot, and you can certainly have it done. So yes, please go for it.
Can I also advise that any males out there who are watching this, please push their wives, girlfriends, sisters, whoever it is, to actually pick up the phone. And if they have been called for one, because, you know, there's 5 million women invited every year to be tested, and yes, although they've been postponed, we need to get women into the surgeries again. So please, males, do tell your partners, your girlfriends, your wives, whoever it may be, to go and have their tests done.
Definitely. And another question we just had come through is, why is the smear test started in the mid-20s, not earlier? And I suppose something that comes on from that, does family history play into it? If you've got a family history of abnormal cells, does that affect the age that you're called up?
These are really good questions, actually. So, some people might recall, and when I started my medical training, actually, so the smear tests were being done at the age of 20. Now, they were pushed to the age of 25 because between 20 and 25, now, you've got to remember that tests are not perfect, okay? So if they pick up some abnormality, then being who we are, you know, in the healthcare profession, when we see something and that's not quite right, we want to fix it, okay? Because, you know, we are in the profession of helping people. Now, sometimes that fixing is not really in the benefit of the individual. So between the ages of 20 to 25, the precancerous cells and the number of cancers that are picked up are very, very, very small. So small that it does not justify putting a whole host of young women through that, probably, I would say, the discomfort, the emotional and the mental and the physical stress of having a smear test. Hence, it was found that it was actually moved to the age of 25. So the first invite now is to have a smear test at the age of 25. Having said that, if obviously what we tend to say is that if women are concerned, women will never be denied a smear test. So, you know, if a woman at 21 had some abnormal bleeding or spotting or some sort of symptoms, picked up her phone and rung the GP surgery saying she wanted to have a smear test, she will not be turned away. She'll be called in for an examination, and then you can discuss having a smear test and have it done. So it's not that they're going to say, so it's not a law that you can't have a smear test. You can certainly have it if you're younger, as long, you know, and you're concerned about it. The test will be offered. So I don't think anybody should be worried and put off. What it was not justifying was, and it was felt that the risk was higher than the benefits, and so which is why we've moved that age to 25. And also, you've got to remember the vaccine program has kicked in. Okay, so the effect and the impact of that vaccine, it is hoped that, you know, obviously the cancers and the precancerous changes will drop very significantly. And if that is one battle we can win, I think we can all, you know, I certainly would consider it a career success for me. So, you know, my peers, that's what we really want to see. We can certainly, you know, a preventable cancer, we should drop it right down. And then, you know, if there's a successful vaccine program, just like polio, I mean, you know, some of you may not remember it, but, you know, polio was eradicated in smallpox. You know, all of this was eradicated in many parts of the world. And if we can get rid of cervical cancer, that would be fantastic.
And I'll just say, I do know someone who was below the age of 25, my friend's daughter, and she hadn't been called for her for a smear test, but she, you know, she had certain symptoms. I know that she had some bleeding after sexual intercourse, and there was pain, and she also had a smelly vaginal discharge. So actually, she made the call to the doctor just to have herself checked out, and that was definitely the right thing to do. So again, if you see, feel or see anything that's not normal, don't be afraid to call just because you're not 25 yet.
Thank you both. Yeah, I think they're both very kind of important points just to say don't be afraid to pick up that phone. And I think the last question we will go on to just come through. How long after having a baby can you have the smear done, and can you have the test done while you're pregnant? Dr. Kavita?
Yeah, so this, again, very good questions. So thank you. So essentially, so what we tend to say is, so it is not recommended when somebody is pregnant, and it's just because of the way the cells behave and things like that. It then causes further problems. We end up over-diagnosing or over-treating, and in pregnancy, those are all not good things, and you don't really need the stress of it while you're pregnant. So what we tend to say is, so women have it at a postnatal appointment. So what they tend to have it done is, if they have put off a smear test, it's quite rapidly picked up, and usually they get offered it. So pretty much after 3 months, and a lot of the changes have started to settle down. Women are often a bit more in control of them, what's going on in their life. They've probably got used to a bit of the sleepless nights, all of the other changes that have been going on. So I think, and then after that, it's probably a good time to actually have it done. There's no perfect time, there's no specific time, but so around the 3-month mark is when a lot of women that I've come across think actually it's a good time to have it done, and they schedule it. But often when they have postnatal checks, the midwives are often on it and bring them in very quickly to actually have it done. So, and advise them to basically go ahead and have it. So that's a very good time to sort it out. So it doesn't really matter when, so if there's two things I'd really like to say during this time, as this is Cervical Screening Awareness Week, and really thank you for having us to discuss this. But really, it's taking a cervical smear test is a fairly important thing, and I would probably say that that and vaccines, those are my two take-home messages really today. Is that really there's no shame or embarrassment in talking about all of this. This is our body, and we have a right to be in control of our body. And these are two things that is available on the NHS to young women, and which can have a huge impact on our lives. Okay, so vaccination, it's available for boys and girls. Smear test for anybody with the cervix has a smear test. Okay, so I'm not going to say just girls, because with people with gender changes happening and all of that, so anybody with a cervix, a smear test is available with the guidelines. And then yes, please go and have it.
Fab. I think you kind of led on to my next question. Unfortunately, we could go on for hours with the amount of questions and your knowledge, and kind of both of your knowledge. Is there anything that you want to say to our students and any young woman out there that's maybe thinking of, do I need a smear test, or the hazards? Is there any kind of final words?
So I would say, so obviously, if you're over 25, hopefully you've had a smear test. If you haven't, please pick up the phone and bring your doctor's surgery and have one scheduled. And it's, very weird way to treat yourself, actually. It's a way of looking after yourself in a strange way. So please go ahead and have it done. And if you're young and you're under the age of 25, you missed out on your vaccination, that's something to talk to your GP about as well. But really, look after yourself. This is really a way of looking after yourself. So, please take care, and all the very best. Thank you.
And I'll just add to that, I think, talk to your girlfriends about it. Even if you did it as, make sure you spread the word and actually share the importance of you having it done.